How is everybody? Dr. Katka Novakova here. We have a beautiful sunset today, so I want you to enjoy it. And as you are enjoying the sunset, what I want to do today, I'll enjoy it with you, and I'm going to share with you just very briefly. How is this for perfection? Almost perfection. Aha, a little crooked, but that will do. I want to share with you very briefly today, during this amazing sunset, how to maximize your visit to your physician. Because these days, everyone is on such a high overload when it comes to data, when it comes to time management, including actually your doctor. So I'm going to speak from my experience, what makes the visit usually very easy for me and thus for the patient coming in. Whether it is a visit to your naturopathic doctor where you're taking your own resources and your time and you are wanting the best possible second opinion, and the appointment is anywhere from 30 to 90 minutes, or you're just visiting with your primary care doctor and your appointment is anywhere from 10 to 20 minutes. So the best thing is when it's a new patient visit, the more information that the doctor has available ahead of time, the better. So today we want to make sure everything is in ahead of time via digital form. So I always appreciate not only that patients fill in the paperwork that we need them to fill in ahead of time and email that to us, but they actually take the time and create a document that's a digital document, preferably something that I can cut and paste into my notes that has their timeline. We can use years, but it's even better to use ages. So let's say if I'm 46 years old, then I'll go from, we can go from age 46 down or vice versa. But any event that is important for my doctor would be listed, whether it's surgery, whether it's dental surgeries, whether it's removal of teeth, whether it's, mammograms, appointments with skin doctors, all the list of medications and supplements and the dosages and how long I have been taking them. If I have blood work that's available that the doctor may not have, I would want them to have it. So I'll either make sure I request it ahead of time or I actually bring a hard copy with me. So I do my own little medical history ahead of time in bullet points. That way I know the doctor has the basics, and then we can always, the more I have in front of me when I see the patient for the first time, the more time that's allotted to the appointment I can actually spend asking the questions that really matter, that can get us deep, that can really get the value of the appointment and get it maximized, meaning that if you're coming in, you would be leaving knowing that we have really touched upon everything that needed to be touched upon. So once I do the medical history, and the best thing to do that is in bullet points, okay? It's best to do bullet points 1, 2, 3, 4, 5, or just literally bullets or a little dash and then writing. Because if I get an email that's literally 4 pages of Word document, it's very difficult to orient myself in there. I do appreciate that information, but it takes a long time for me to go through it. And oftentimes what happens to me, at the end of it, I actually don't even know what the questions are, what the patient actually will be coming in for, what are they needing from me. So make it very clear. Here's my medical history, here's my list of medicines and supplements, here are my primary issues. I have pain here, I have headaches, I have skin issues, and then here are my goals. If you bring that in, we can go so deep, because then the idea is, let's say somebody has skin issues and has had that for a long time. From the naturopathic standpoint, I'm going to start asking, okay, if this started at age 35, what happened about 6 to 12 months prior? So you can already get a little head start. Usually, unless there's an obvious trauma and injury, right? When there is a chronic issue, whether it's hypothyroid, whether it's skin issues, whether it's headaches, whether it's any kind of pain, any kind of chronic illness, it usually is related to something that happened within 6 to 12 months prior. We have moved house and the house was, had some molds in it, or we moved to a golf course and they spray the golf course every time. You name it. So start thinking, start being your own detective when you do this work ahead of time for your doctor. I think the sun is setting early today. You see, it's going behind a cloud. That's okay though. We'll just enjoy it beautifully. But the idea is, when you kind of put the time into it, even though, like I said, we're all pressed for time these days, when you put the time into it, you kind of start thinking and you realize, oh, wait a minute, there's this important information that I think will really make a difference. Remember, traditional medical doctor does not have as much time, but still it really helps. If you want your prescriptions, it's good to know for the doctor, I need this and this and this medication refilled. I have this new pain and I have swelling of my left leg since 3.5 months ago, and I don't have any blood work since 6 months ago, and here is the blood work. What's the next step? If you come like this, there's actually time left for questions and time left for, nice hello and nice goodbye, and it actually will be very pleasurable appointment, hopefully. When you come to me, we have more time. So, or any other naturopathic doctor or holistic healthcare provider. So the idea is that the more you bring, the more I can kind of pick and choose what's important, what ties together. Remember, in our body, everything is related. And oftentimes, mental, emotional, and spiritual aspects are related. Honestly, even injuries, this is so crazy, right? But even why would I, hit my knee or break my leg or run and sprain my ankle? Why would that happen? Usually is when I'm not fully present in my body. Usually is when I'm distracted by some stressor, family member is going through something, or I'm going through something at work, or there's usually a correlation there as well. But for the big ones, I just had this young lady come in for the first appointment, and she said, I just need to feel better. I just need to feel better. And I know, trying to kind of figure out. And then she started feeling better. And then her beloved sister died, and everything went haywire. And the whole endocrine system and nervous system literally fell apart. And so we're trying to patch it from the outside in, but we really have to go and dig deep and start looking at the bigger picture, and that's what naturopathic medicine allows us. I have had, fortunately and unfortunately, a lot of people come to me because they did not get what they needed from their physician, meaning there was not enough time, there was not enough medicines other than literally drugs and surgery. It's just what they were getting wasn't producing results. So finally they thought, oh, there's something else going on. It's not just in my head. I'm not just going to wait and see. So they decided to come and see me. Isn't that a beautiful sunset? So when they come and see me, I need all that information ready to go, so then I can actually take that so much deeper and literally go to the core. And there's usually multitude of cores, meaning, oftentimes from very early age, let's say I just had a patient, they had their amalgams done at 8 and 9, and they started feeling extremely fatigued, they started perspiring, they weren't able to sleep. You name it, it started already there and then. So that tells me their liver detoxification pathways are not only tasked from a very young age, but they're unable to clearly eliminate and break down toxins and eliminate them. So there's some probably genetic, but we all have some genetic aspects, meaning some genes are working better than others, and that there's this whole picture of epigenetics that we have to look into. What's my environment that is stimulating one gene over the other? But we look at all of that. So don't hold back on, age 5, this happened to me, and I'm gonna put it on the schedule there, because on my list because it will be important. Anything and everything is important. So don't hold back. Please take the time to write this down and to bring it to the doctor. And then the other thing that really helps, if you can in your schedule, always come. What helps me is I try to run on time, but as much as I can, I oftentimes don't manage. But I try to run on time, and there's times, sometimes I'm early or somebody cancels right before. So especially if you're a new patient, bring in a ton of paperwork. Come in early, get your water, use the restroom ahead of time. So then when I'm ready to start, we can actually start and maximize the time. It's quite awesome to have a little extra time, because trust me, every time I have a little extra time, I use it. And then so it's always nice to know your goals. It's always nice to know and have it nicely, neatly put in, either a Word document or something that can be cut and pasted, and we just take it from there. And makes it easier on you, and it makes it easier on me. And so I just thought that would help us for today to just go through that, because I had a lot of patients kind of coming, what do you need? What do I need? How do I prepare? How do I prepare? And then if we're really well prepared, we can literally do so much in that time we have together. Sounds good? Okay, so look at that beautiful sun. I'll just give you one more little peek. And I will see you tomorrow. And the one thing I want to say, I just get so many emails from people. They're just telling me they're overloaded on time. They're literally not managing. So I so appreciate you taking the time to witness this beautiful sunset with us. We have a little helicopter here, which you think you're hearing something going on. So we'll just bless that too. But thank you for your time. And what I would love to know, if there's something you would want to hear, please let me know. I would so love to share with you whatever it is that you are looking for. If there's anything I can help you to make your visit to your doctor easier, please let me know. I would be honored and very happy to do that. I'll share with you also, next time, another time, as to what is the patient that really benefits from coming to us, because not everybody benefits. So it's always nice to know when you're calling a doctor, this is what I need, and can you help me? And I can tell you, yes, I can help you, but maybe if you're looking strictly for hormones, I'll send you to my colleague, because she specializes in it. So the more you ask and the more you send ahead of time, the happier and very much better all of us will be. All right, you guys, I appreciate you a ton. You take good care, and a happy sunset time, and I will see you tomorrow. Thank you for being here. Take care. Bye-bye.